See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association and hosted by nurse economist and health tech specialist Shauna Butler.
I'm Shauna Butler, the host of See You Now, a podcast that shines a light on the nurses addressing today's most challenging healthcare problems, and never has that light been so bright. As the entire world adapts to a global pandemic and responds to the massive disruption in our lives, it has challenged nurses to rapidly rethink and redesign how and where they work. Over the next few weeks, See You Now is bringing you stories from the nurses in the midst of the coronavirus pandemic who are finding new and novel ways in real time to care for all of us. As the enormity of the coronavirus pandemic sweeps across the globe, citizens everywhere are becoming aware of just how strained and vulnerable our healthcare systems are. And at the core of these systems are nurses, in particular, the highly trained and skilled nurses needed to screen, test, and care for patients, families, and communities responding to COVID-19. And that's where our story today begins, with nurses Sarah Gray and Dan Weberg, who are the innovation strike force at Trusted Health on a mission to modernize and personalize how we mobilize and deploy our healthcare talent and workforce.
Nurses are raising their hand to go and provide this care on the front lines, and we can get them there oftentimes in a matter of hours, but they can't actually work or step foot in the door until they're able to be recognized as a licensed professional to work there. My name is Sarah Gray. I am a pediatric medical surgical and transitional care nurse, and I am the founding clinician at Trusted Health.
Hi, I'm Dan Weberg. I am a ER and trauma nurse at heart. I'm the head of clinical innovation at Trusted Health and also an assistant professor of nursing at The Ohio State University College of Nursing.
The traditional approach of recruiting and attracting nursing talent has been asking for or seeking nurses when you needed them yesterday. That tends to put organizations in a difficult spot. As coronavirus started spreading throughout the United States, Trusted reacted in a similar fashion to how we have been, is quickly. Where Trusted's secret sauce is being able to leverage technology to quickly engage a nursing workforce of over 100,000 nurses. And as these really high impact opportunities have started cropping up across the nation due to coronavirus, we've been able to quickly engage these nurses in minutes from the time that a healthcare facility says, hey, we need 100 nurses by next week. We have all of the information, the data to understand what kinds of nurses are looking for what kinds of opportunities, where they're willing to go, as well as all of their credentialing and compliance information. Coronavirus has really shined a light on the problems with the regulatory hurdles that get in the way of connecting nurses to the care.
The supply and demand of nurses is completely imbalanced, and part of that is because it's very locally driven. There's not actually a database across the country that tells you how many nurses are in one spot working and what their skill set are and where they're moving to. And so it's state by state and even facility by facility. And so that drives a very big imbalance between how you move the supply of nurses to the demand. It's been accelerated through COVID. Before, many state boards of nursing took 7 to 13 or longer weeks to get a license. And even with COVID, the regulatory bodies were a month behind the national crisis.
Trusted is on a mission to get everyone everywhere care, and we're starting by mobilizing the healthcare workforce and focusing specifically on nurses.
We have nurses that do all kinds of different roles outside of the hospital setting, everything from ambulatory clinics to community health and beyond. We have nurses that are placed in the streets of New York working with the NYPD and doing homeless checkups and actually COVID screenings currently.
When we look at the state of the world today, what's needed the most is support for nurses. We hear several times a day, I need 100 nurses by next week. It's also recognizing that these 100 nurses aren't just a number. There are people who are putting their lives on the line. We're responding by being all hands on deck to support our nurses, to create the resources that they need to make very critical decisions about where they're going to provide this care, what that means for their lives, for their families. As they're making these critical decisions, they have an entire support team to help them through those.
That's really the reason I joined Trusted, was to be able to build a platform that looked at nurses as an individual with a certain set of skills and a passion to do great things in the world, and connect that energy to the needs of patients and hospitals and facilities, and even outside non-clinical type roles as well.
I think the one lesson that I hope we all learn from this is that it can and should be easier to mobilize nurses across the country. And there doesn't need to be nearly as much friction as there has been pre-COVID. And while the friction certainly still exists, it's far less than it was pre-COVID. And that's lent us asking why it was the way it was before. And the lesson we need to learn and what we'll be working on is to ensure it doesn't go back to how it was before. Times of chaos breed innovation. We're in a position now more than ever to be the voice of change and leverage the voice of the nurse.
2020 was designated by the World Health Organization as the Year of the Nurse and Midwife, with the intention of highlighting the significance of nurses and raising their profile. COVID-19 has exposed the challenging and demanding conditions nurses confront and put health systems on high alert to the vulnerabilities they face when there aren't enough nurses with the right skills in the right places, and what happens when we don't protect them. The changing needs of the 21st century and this new era of vulnerability to COVID-19 amplify the even greater role nurses must play in the next iteration of our health systems. New and innovative types of services are needed, those that are more community and home-based, more holistic and people-centered, with an increased focus on prevention and making much better use of technology. These are all areas where nurses are leading and innovating. Optimizing nursing talent requires that nurses are intelligently deployed, valued, and included in policy and decision-making. As we clap daily to express our appreciation for the health workers around the globe, let us not lose sight of the investments and protections that they need to be safe, healthy, and strong enough to ensure that everyone, everywhere, gets the health care they deserve. For See You Now, I'm Shauna Butler. Thanks for listening and staying connected while we're apart.
Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Johnson & Johnson and the American Nurses Foundation are excited to launch the Coronavirus Response Fund for Nurses. Go to the American Nurses Foundation website to learn more, share, or donate. And thanks.